Hi, I'm Dr. Arundathi, consultant dermatologist at Dr. Sculpt Aesthetic Clinics in Indiranagar and Sahakarnagar, Bengaluru. So today, I would like to talk to you about important components of the anti-aging armamentarium, namely Botox and Fillers. So these are one of my favorite treatments to perform in the clinic because in a very short period of time, it gives such gratifying results to the patients. But there are a lot of misconceptions and fears around these really excellent treatments, which I would like to dispel today. Let's start off by talking about Botox. Okay, so Botox is actually a trade name that has now come to stand for the treatment itself. So Botox, the drug, is actually on a botulinum toxin type A. It works by temporarily relaxing the muscle into which it is injected. So this effect of relaxation lasts for anywhere between 4 to 6 months for each individual patient. So Botox helps in reducing or erasing wrinkles, that is, the lines that form when we move certain muscles on our face. It also can be used as mesobotox. So as mesobotox, it helps in reducing the fine lines and reduces the pore size on our skin. It can be used in the treatment of excessive sweating or hyperhidrosis as we call it. It also helps in lifting the lip, which we call lip lift, and it also helps in defining the jawline, which we call Nefertiti lift. So let's consider some of the common misconceptions about Botox. I'll be choosing some questions that I have been asked in clinical practice by patients to whom I've suggested Botox treatment. So the first question that people usually ask me is that, you tell me that Botox only lasts for 4 to 6 months. Will I end up looking worse after the treatment wears off? So my answer would be, that simply is not possible. So Botox does relax your muscles temporarily, but once the effect of the Botox wears off, your muscles will slowly regain full capacity and they will come back to what they were before we did the treatment, and it is never going to get worse. In fact, we suggest that we start taking Botox earlier on in life in order to prevent the lines from worsening. So another very common question I get asked is, won't Botox make me look unnatural? Like I've had some work done. So here there are two things that I would like to tell. One is, it is very important to choose who you get your Botox done. You have to choose your injector well, somebody who is trained in doing Botox, because at the end of the day it is an art. We have to strategically place the right amount of Botox into the right place in the muscle in order to give the desired results. Overdoing the Botox or not placing the Botox well can give rise to this unnatural look that people are usually scared about. Like any clinical treatment, people are often worried about the side effects of Botox. I would like to say here is that if Botox is done well, it is a very safe and effective treatment. Though it is a toxin and people are scared of the word toxin, it is a highly purified compound and the amounts that we use in cosmetic treatments are very small. In fact, Botox is not only used for the treatment in cosmetic treatment, but it is also used in treatment of some neurological conditions such as muscle dystonias, spasms, etc. And people are often worried that it can be a painful procedure. We say injections and they imagine that it's going to be a little painful, which is valid, I understand. But Botox is given very superficially and we numb the skin with a numbing cream before we do the treatment. So in effect, people hardly feel anything when we do the treatment. And it is a very simple procedure that's over in within 10 to 15 minutes. And people often ask me, is this a one-time treatment? Do I have to maintain it? Like I said before, Botox only works for about 4 to 6 months, following which you will have to repeat the treatment. But doing so regularly can actually, like I said before, can avoid further development of lines on your skin. So there are two types of lines, wrinkles, that is the static and dynamic wrinkles. So dynamic wrinkles are the wrinkles that form only when your muscle is in action. That is, when you lift your eyebrows, when you frown, when you smile. These are the lines that happen only when the muscle is in action. And then if you don't treat the lines at this stage, they develop slowly into what are called static wrinkles. These are lines that you can see on your skin even when you are not moving the said muscles. So, Botox in essence can prevent the development of static wrinkles, and people are often apprehensive that they are too young to start taking Botox. So, I told you about the two types of wrinkles before this, static and dynamic wrinkles. So, when we do Botox on dynamic wrinkles, we can erase the wrinkle completely. and we can also prevent the progression of these wrinkles into static wrinkles. But over a period of time, these dynamic wrinkles can turn into static wrinkles. So when you start doing Botox very late, even when we do the Botox, there will be a faint line still visible even after the treatment when it comes to static wrinkles. So I always advise my patients, start Botox in your mid to late 30s and prevent development of further lines on your skin.